I think health communications has done a great job combating fake news during the COVID-19 pandemic. And I see that being driven by two key unprecedented forces. The first one is the government took a very proactive approach from the beginning, from the very top, from the Prime Minister, the Secretary of State, and everyone else involved was very clear right at the beginning, pleading with the public, do not share disinformation, do not share information from trusted sources, and in particularly their name-checked, encrypted and private sites. So much less Facebook and more WhatsApp. They were telling people, do not share on WhatsApp sources of information, go back, reference with the official departmental website. And I think that was really critical and really unprecedented. And again, because of the circumstances, people actually obeyed that and did it, which was really a new and unique force behind message adherence in this case. Now, at OVID Health, we are worried about disinformation and fake news, particularly in the space of vaccines. Early in the pandemic crisis, we commissioned some polling around vaccines confidence, and right at the very height of fear and concern around this new disease, we asked people what they would do if a vaccine was available. And of course, accepting that it's notoriously difficult to ask people hypothetical, future-based, action-based questions, the polling still came back largely positive, but still with a substantial number of people in different age categories saying they would be reluctant to take a vaccine. And that kind of sort of fake news driven really concerns us. Now, the health campaign that's really impressed me recently has been the Wash Your Hands campaign. Again, it was by nature of the situation really simple. It had a clear call to action. Now, we can't always be this simple, but we can always be clear in our call to action. It gave a really shareable feel to it. It worked on social media. I'm not sure if that was the intention, but it did work. The happy birthday song, and then people came up with their own songs. It really gave it onus and ownership. But I think what I really liked about that campaign was the nudge theory elements they used right at the beginning. You will remember the posters they had of door handles and other shared surfaces where they used the infrared light to demonstrate where all the germs were sitting. What they were doing there was eliciting a real feeling of disgust. So they were using feelings to drive behavior change. And that really is the key. I think now health communications has really changed. It's proven that through emotion, through emotional resonance, through feeling, it is where you get people to take action. I started out my career remembering all the public health campaigns there are, and sadly there are still some that just believe if only we told them that takeaway food or too much drinking or smoking was bad, if only we told them that exercise was good, if only they had the information. Actually, what we know now is that behavior change is driven by emotions, it's driven by complex circumstances. But I think we're still in danger zone. We did see a high level of sharing of fake news. There is still propagated. And I think while trust is high at the moment in science, even in pharmaceutical companies, it's at an unprecedented height. I'm worried that going forward, some of our interventions, whether that be in vaccines in particular, but also in the diagnostic space, might be compromised by the sharing of fake news.